Let's turn to Dr. Uche Blackstock. She's an emergency room doctor in New York City, the founder and CEO of the group Advancing Health Equity. Doctor, it's nice to talk to you. Thank you.
Thank you for having me.
So much talk about the big cities, yet you're focused now on the small towns out in the heartland.
Exactly. I think, we're seeing a surge that I feel like could have been avoidable. And we're seeing it as a result of multiple small gatherings, families getting together. And as was mentioned in the earlier segment, we definitely have to be concerned about going into Halloween, Thanksgiving, Christmas, having more indoor gatherings and seeing hospitalizations increase as a result.
I'm looking at newspapers and websites all over the country today. Long Island, a Sweet 16 party, a super spreader, a wedding out west, a family get together down south. People are COVID weary. They want to see their people. What do you tell them?
I know, and I get it. I get it. I wanted to see my family too. My father is in Florida. I haven't seen him in a very long time because he's elderly. But the fact is that we have to hold steadfast. We know that masking, physical distancing, and especially as we head into the cold weather, avoiding indoor gatherings, indoor dining, gyms, it's going to really be key to getting on top of the infections. Doctor,
the most concerning really for me, and maybe embarrassing for our nation, is the state of the PPE. That our heroes in the hospitals don't have the protection they need after all these months, knowing this was coming. I talked to lots of doctors who were telling me, but have you experienced this? And do you know what the specific needs are?
Yeah, no, so actually this is devastating. We had 6 to 7 months to prepare for this. And unfortunately, we still have an urgent PPE shortage. We haven't been able to mobilize domestic production of PPE. We needed to invoke the Defense Production Act to ensure that we have adequate N95 masks, surgical masks, disinfecting wipes. And we really are letting our healthcare workers down.
You look at Wisconsin and Iowa and all the trouble that they're having. I look to my home state of Mississippi, where 6 of the hospitals in that state are completely out of ICU beds. And you wonder, are those health professionals going to be protected?
Right. And what we're going to see is they're going to be reusing N95 masks. N95 masks are really only supposed to be used once per patient, and now they're using them for weeks on end. We have to do better for our healthcare providers. We need a national strategy, not just around testing, contact tracing, but also around domestic production of PPE.
Shepard Smith here. Thanks for watching CNBC on YouTube.